Welcome to Ageless by Rescu. This podcast is devoted to exploring the science of rejuvenation, uncovering the most trusted experts, the must-have products, innovations, and technology in the field of vitality, aesthetics, new beauty, and cosmetic enhancement. I'm delighted to introduce you to Dr. Rahma Targett, who is here with us as a guest of NuEra. We're going to talk about the most frequently requested subject matter, which is how to tone and firm our bodies without having surgery. And we're talking about a subject that you are an expert at in your clinical practice in Adelaide. Welcome to Ageless by Rescu.
Thank you, Baha. And
Let's
nice
talk
to meet
about
you.
radio frequency technology. Why did you pick this particular technology in your clinical practice?
Well, as you know, as radio frequency as it sounds, it's mainly used for telecommunications, but it's now very popular for in the cosmetic industry. So I chose it because it has the least side effects. You can control. You less likely to burn the patient, and it's quite comfortable. It doesn't hurt, and patients don't like pain.
And what is the technical specification of radio frequency for those of us who haven't been exposed to this technology in skin tightening, fat reduction, cellulite treatment?
Well, when it comes to all these modalities, it means that it's the patient is connected to electric current. For instance, when we talk about NuEra, I can only talk about NuEra because that's the machine I have. We connect the patient to a pad or electrode and connect it to the machine. So the machine will actually, you enter the patient's age, weight, and height, and it calculates the energy that is used for whatever patient wants to treat. So it's quite specific.
And what is
so
the
we wanted
benefit of, sorry, go ahead.
Okay, so you want to target the fat cells or the skin tightening. It has specific functions for all those treatments. So it's quite personalized.
And we love personalized because obviously that's when you start to see the best results. And speaking of personalization, how does radio frequency treatment work alongside diet and exercise? I assume that you have to also be taking care of that, and the RF or a NuEra treatment would be an overlay to whatever you're doing in your health and well-being space.
Well, just like in any other weight loss modalities, so if you want to reduce fat, diet and exercise is still the best to do initially. And NuEra comes into play when you've got this pocket of fats or resistant fat that you just can't get rid of. And no matter what you do with your diet and exercise, it just doesn't go away. So that's when NuEra comes in and help you achieve that goal of getting rid of those unwanted pockets of cells or cellulites or loose skin that you want to target in your body.
In your clinical practice, what are the most common areas that men or women come to see you and then you recommend NuEra skin tightening and fat treatment?
I think the most popular here is mainly the fat under the chin.
Right.
Yes, cellulites and pocket of fats on the tummy. Some also comes with the inner thighs. They've been doing a lot of exercises, the upper inner thighs. And tightening of the neck is very popular, jawline. And they even come now for periorbital tightening, which NuEra can do.
Wow.
Yes.
So if I was a patient and I came to you, what would the assessment or the consult process look like?
Okay, so of course, we would ask you to come 15 minutes before your appointment because there are a lot of forms that you need to fill. And then in part of that form there will be explanation of what NuEra is. And then I will take your medical history and assess you, and also ask you what you want to achieve, because what you want to achieve and what I can deliver has to match. And I am the type of practitioner who don't overpromise. I normally do underpromise and overdeliver. And yeah, I can explain how the process is. We also discuss about the cost of the procedure, what I can achieve and what this machine can achieve and what it can't do. And I will be very honest.
I'm interested in that discernment, because obviously you're a doctor, you're running a medical
Yes.
practice. And
Yes.
so I would assume that your research and investigation into options was quite extensive before settling on the NuEra technology. What is it about this particular device? Because I have to say to you, speaking on behalf of many women my age and who are curious about using devices instead of surgery, there's been some hits and misses and a lot of big promises. And, I would like to know what is the difference that made you choose this device and this technology?
I think the main reason I got this machine, and I've tried other machines in the past, that is pain-free. It's quite comfortable. That was number one that made me buy this machine. Number two, I can actually achieve many things in one treatment. Like I can do fat reduction. So NuEra has this new logic setting only for the advanced users, that you can actually do the setting that you can do fat reduction and skin tightening at the same time.
But that's the holy grail, right? Because it's one thing to get the fat reduction, but you often, when you do have quick fat reduction, the skin laxity is the nightmare. And that's normally only surgically treated.
Yes. And I've got lots of happy patients, especially on the chin. They've actually had, the injections, and I do them as well. But I think now I was like, look, we can do the fat reduction and skin tightening at the same time in the same treatment. And that is actually a really, really good, and plus it doesn't hurt for the patients. And they go like, okay, I would like to give it a try. Okay, not only that, number two, I can also target different levels of the skin. So NuEra can go from, you can target the deeper level of fat with 470, sorry for being technical, kilohertz, and up to 6 megahertz. So you can go deep and then superficial and, treat different level of the fat and the subcutaneous tissues in the skin to achieve.
When I was reading the technical specs of NuEra, that was the thing that really blew me away, the level of precision and the different layers that you can go down, because quite frankly, surgery can't even do that, because surgery can only get to a certain number of layers. But with the NuEra Tight, you're going through multiple layers and you can adjust for what you want to achieve.
And like I said in the beginning, it's personalized. So, the patient age, height, and weight is entered, plus their gender, or female or male. And it is set especially for you. It's your personal setting.
What are the concerns that people have when they're investigating non-surgical devices? What do they typically worry about?
I think they mainly ask me about side effects. And the beauty of NuEra Tight is there's no side effects really, except flushing of the skin. It's quite comfortable. My patients often describe it like a hot stone massage. Compared to other machines where you can get, the fat can go hard, or there could be some proliferation of other fat cells as a side effect. You must have read some of those side effects.
We did a whole episode on fat freezing, which was
fat freezing,
of course, such a popular fat reduction modality.
Yes.
But it does have side effects that can be present in 3% of the population.
And it can cause it can be quite disfiguring for other people, having lumps or unwanted fat tumors here and there from it. what do you call that again? It's called paradoxical
Yes,
adipocyte
PAH. Yeah.
hyperplasia. Yeah.
Hypoxia.
So another advantage of NuEra that I really like is we've got different sizes of
The treatment heads
probe.
I saw. Yeah.
Yes, the probe. So we get from 20 millimeter to 100 millimeter. So you can actually treat a big area, a small area, as small as your periorbital area or the chin or just the jawline or the face, or as big as your tummy.
And is there a limit to how many areas of the body you can do in a single treatment? Is there a safety issue around that?
No, no. Except that we have a lot of therapies so to treat them, to prevent all the RSI and all that stuff. So I'll have at least 2 or 3 to go ahead and change over. Yeah, I have a patient from the country, and she comes and we do her tummy, her flank, her inner thighs, her knees, her legs, her neck. She comes just for the day, so she might as well get it done altogether with no side effects.
So you've mentioned a couple of unusual places for treatment.
Yes.
We get a lot of inquiry about unusual places, but what are some of the more unusual areas of treatment?
You've got skin laxity on your axilla. A lot of people, when they, when you wear your tank tops, and then you got that wrinkly thing there. I've got patients
this
that
wrinkly
treated.
thing here.
Yeah, this one. Yeah.
I know
and
the one.
And people I've had a patient, and this is a real one. She lost some weight and she's quite fit. She's a yoga teacher, but she didn't like the wrinkle on her knees, just before the knee, that fold
I've had
there.
threads on my knees. That's how much I don't like the wrinkles on my knee.
We treated that and she was quite happy with it. We just did the skin tightening.
And what about the hands? Are you able to do treatment on the hands?
I'm sure you can. I haven't tried it, but yeah, we did it a lot on the arm, the inner arm. Yeah. So people who lost some weight, they've got laxity in there. Some, slight to medium, not a terrible laxity, because only a surgery can cut that, I mean,
tell me about cellulite, because this seems to be the area that there's a lot of promises. Well, there's a lot of promises, but not a lot of results. And as a doctor, as a clinical practitioner who's invested in technology, what have you seen this device actually deliver on? And, what can we expect to see?
Well, let's be frank and say that cellulite can only be improved. You cannot totally get rid of cellulites, especially in women, because our bands are vertical. The men are so blessed, they don't have that problem. Look, with NuEra, we can actually, what I normally do is, if the cellulite is severe, the NuEra has setting for severe cellulite. So what it does, it dissolves the fat in between the pockets and tighten the skin at the same time. So it gives you that smoother look. And people can see the result as much as even the first or second session. And we normally complete the 6 sessions anyway, but yeah.
So for each area of the body, you would have the treatment. How long would a treatment take, say, for the tummy?
So when we do treatment of tummy, we normally divide it into 2. So 20 minutes each side.
Right. So you
to maintain the heat.
And so that would be 1 session. And then you would recommend that the patient come back for a course of 6 treatments?
Yeah, a course of 6 treatment weekly.
Weekly.
Some people can't come if they can't manage weekly. They come every fortnight. We've done that before. And we still get good
so
results.
You're saying that it's possible to see some improvement immediately after, or is it a couple of weeks after?
I think most of my patients, especially with cellulite, they see the result. They see some improvement even with the first treatment. That's the feedback I get. I can only speak about my patients. I don't know about other.
And what about for fat loss, for more a fat loss treatment? So around the tummy or the saddlebags, or?
Well, first of all, we don't use NuEra for weight loss. You know that, right? I mean, I would be very careful in selecting my patients, making sure that they are quite serious with their diet and exercise. And NuEra is just there to, improve the outcome of their diet and exercise, and to enhance the goal, the result. If a patient says that I want it for weight loss, I would say, no, I think we need to talk, because I do weight loss program as well. So I would probably put them on a weight loss program first with diet, exercise, or some other medications before I would go ahead and do the NuEra, because I want to achieve a good result as much as they do. And you're also helping them to, improve their lifestyle and
So
to have a long-lasting results.
So if you're coming in for, say, skin tightening, just skin tightening, is it a different treatment and protocol to if you're coming for, say, skin tightening and lifting, or
it's different protocol, and the machine is quite intelligent enough. It has all those settings.
Yeah. So if I was to come to you and I had multiple concerns, it would be the same NuEra machine.
Yes.
The same series of treatments, for example, 6, but we would have different protocols to achieve different outcomes.
That is correct. And besides, NuEra has a setting for each area of your body. So
what can you do for the bum area? I mean, Brazilian butt lifts are huge. It's such a,
I actually have done that with a friend of mine. We use, I think what I did that with the skin tightening mainly. And which I didn't want to dissolve the fat on her bum, obviously. But if they have excess fat, just below the bum, on the upper thigh, if you get rid of that, it helps the butt to lift a bit, and you do the skin tightening. So it's so interesting because every patient is so different, and all my settings are different for everybody. And I will make my setting there and then, as while talking and doing the consult and explaining the procedure, it's all there.
So we said that we can't treat cellulite, but we can definitely improve the
improved, yes.
And the tightening of under the neck, or the skin laxity.
Yeah.
How long does the result last for?
I think it should top it up every 6 months, I think. Like I've had patients last year and she's still quite happy, but she's going to go to the Gold Coast and do her surfing. And she says she just want to top up. So we did one treatment and she's going to come back next week and we'll do another one. And it depends. Everyone is so different. Your definition of being, not having cellulite or is different from mine. So it all depends on the patient's personal preferences. Yeah.
I want to circle back to the conversation we were having between RF, radio frequency technology, and fat freezing.
Yes.
What is the difference, and who would be the candidate for RF that you would definitely recommend RF treatment to?
Well, fat freezing mainly target, the treatment area is in one spot. And if you're treating a large area, that will be difficult to achieve. And they will have to go back multiple times for them to treat. While NuEra, you can treat multiple areas at the same time in the same consult or the same treatment day. They, I think, achieve the same thing. They call cell apoptosis or cell death, fat cell death. But the other one is by freezing, the other one is by heating. So I think both are good. Like I mentioned earlier, the only advantage, I guess, of RF is you can treat different, it has different sizes of probe that you can treat larger areas. And obviously the pain is not there, which is a good factor for patients. Nobody likes pain when you don't want to pay and then get a pain at the same time. And obviously NuEra doesn't have the side effect of the PAH that we talk about, which now, because of what happened to
use NuEra.
Not necessarily. I'm gonna say you gotta be healthy. I think thin is, how do you define thin? You could be thin and unhealthy, and you could be a bit stronger but healthy. You know what I mean? I think it all depends on just getting rid of the unwanted fat. So if you're thinner and healthier, obviously you get a better results because you got rid of the little thing that you wanted out, you know. Well, a bigger person will have to work harder on her diet, exercises, and, you know, toning the muscles and helping them with the other, you know, thicker areas of fat deposits or
Can
skin
you
laxity.
have had the problem for too long? Is it ever too late to use RF technology to treat,
I don't,
say,
yeah,
cellulite, like really old
yeah.
cellulite?
No, I don't think so. I don't think so. I think this sort of treatments, it can be of any age, really. I mean, I don't think the machine will say you're too old, but obviously, obviously, when we advance in age, you know, the result that you get is not as pronounced as when you were younger.
And
You know what I mean?
when we were talking about, and you said it very clearly, and it's true, some types of skin laxity really in the area fall under surgical repair. But
Yes, definitely.
how close can we get to a non-surgical outcome using RF technology, and specifically the NuEra technology? How good is it?
I think it's really good for mild to medium skin laxity. And I would be very, very honest during the consult time that, like I saw the other day, a patient who lost, let's say, 25 kilos, and clearly she needed abdominoplasty, you know. And I just said, look, I think what you need is surgery at
And
this
can you
stage.
use the NuEra in conjunction with surgery? So say, for example,
Definitely.
yes.
Definitely, definitely. It can help with even, you know, people who have lost weight and develop, they don't have that much skin laxity, but they develop some stretch marks or post-pregnancies and all that stuff.
That's what I was
It
going to
can
ask
help
you.
to,
How does it work for
yes.
postpartum skin? Like, would it be
Oh, it's
effective?
amazing. It's amazing. I've had patients who had twins and she came in, we had to tighten the skin, and she was quite happy with the result. You know, I mean, obviously it's not as good as surgery, but not everybody wants surgery, you know. They just want to improve what they have, and, you know, in conjunction with diet and exercises, we
So
were able to
6 weeks
smooth.
is not long to get a great result. I mean, that's pretty amazing. There's almost no exercise routine that will give you immediate, benefit. And it's normally after 6 weeks that also with any diet or exercise routine, you really see great results. So it's not too late if you want to get
It's not too late. And I would normally maybe put a patient on an exercise and diet regime first before. And I said, look, once we achieve your weight, then we start this treatment, not together, because you don't want to be tightening the skin and then she's going to lose more fat and then it will be loose again. So yeah, I normally, you know, with my weight loss, we normally make a plan for a year. It's like, this is our goal for the year, you know, and at the end of the year, we'll do this. We'll tighten whatever loose skin that you have or
and you can
whatever
target
fat.
the fat spots that maybe haven't
Exactly.
shifted with the diet and
Yes.
exercise.
Yes.
Where do you find these areas typically are that can't be shifted with, good
You
diet?
know, the bra fat, you
Oh,
know,
yes.
yes. Have you ever heard of it?
Yes.
I think I have it, but anyway, the bra fat, you know, just below the belly button, you know,
Yes.
people have got that just so resistant. And of course, under the chin. Yeah.
Speaking of under the chin, that sounds like it would be quite popular for men to have.
Yeah.
Is the NuEra technology used a lot by men? Is it suitable for men?
Definitely, definitely, yes. I have a man, he had abdominoplasty, and I think after abdominoplasty, you can get that pocket of like a fat, but they actually induration tissues or hardened fat that wasn't along the incision line or below that. And I've treated him, and I'll send a photo. He had, like, all the surgeons says there's nothing we can do about it. But with NuEra, we were able to improve it to an acceptable level for him. And he's like, oh, now I can take my shirt off at the gym. I said, yes.
Right. So he
That's
had
good.
the abdominoplasty and then
Yes.
had still a little bit of a pocket, and then
Yeah, just below the scar, which is normal. People do get that even with the C-section scar. I've treated a couple of women after the C-section scar or before the scar. You've got that pocket of fat in between the scar. Yeah, so you can improve that as well. So a men here, they come, they like contouring their jawline and neck. Yeah, men. And periorbital is quite popular for them because not everybody wants
a bleph.
a bleph, or some of them just don't like too much, injectables. So yeah, we use this around them and, to improve the eyebrow and the skin laxity around the area, and it works for them.
And do you get a good lift in that area?
To some extent. I mean, every patient obviously varies, but the younger, the better.
I do love speaking to you, and I love speaking to doctors because you do err on the side of caution. And I think it's really important for anyone who's listening or watching to remember that the consultation is the most important part of your treatment, and to choose your clinician wisely, because if you do the consult correctly, if you have realistic expectations of what you can achieve, if you're being treated with someone who's got experience and training, that's when you get the best result. And you could have the best technology in the world. And I've had this conversation with lots of people and lots of brands and many beauty editors and lots of doctors. It really is up to the skill of the clinician, in addition to the technology, to be hand in hand. And it is really lovely to speak to you, and for you to to keep having a very sober approach to what can be achieved. Still fantastic, still positive, but let's get realistic.
That is correct.
Yeah. Is there anyone who couldn't have this treatment that you would not recommend NuEra to?
Yeah, anyone who's got metal or implants in their heart. Yeah.
Of course, because of the electrocurrents.
Metallic, let's say any metallic implants. Pacemakers, they are contraindicated, and pregnancy. I don't treat any pregnant women,
And how soon after birth would it be reasonable to consider having, skin tightening or targeted fat treatments?
Look, I would, I've had a conversation recently with a patient of mine, actually. Obviously, you don't want to interfere with whatever is normal healing process of giving birth. So ideally, I would probably after 3 months. Yeah.
And for surgery, how long after surgery?
For surgery, as soon as the wound has healed, probably. Yeah.
Well, I can't wait.
It doesn't really have pain or side effects. So yeah, all good.
Well, it was just an absolute pleasure having you on the show, Dr. Targett. Thank you so much for making time and for sharing your passion for, giving us alternative options. And I think it is all about that. And it's whatever you want to try. And there are definitely levels of, where people feel comfortable. And what I try to do with Ageless is talk about the concern rather than make a decision on how to get there. Once you know what your options are, it's really easy to find a solution that works with your budget, with your timeline. And yeah, it's been absolutely wonderful speaking to you. I really have enjoyed. I know that this is going to be a really popular segment, because anything that talks about cellulite and skin lifting and removing fat deposits is going to be a hit.
Oh, thank you, Bahar, and thanks for having me. And can I just add one thing that I probably wouldn't treat with NuEra Tight is anyone who've got excessive skin laxity.
Yes, we talked about that as well.
We did. So it's very important to have that realistic approach.
And so once again, the consult is the most important part.
Oh, it is.
It's
a paramount. Yes.
Yeah.
Okay.
Wonderful to speak to you, Dr. Targett. Thank you so much for joining us. And I look forward to seeing you next time I'm in Adelaide.
Oh, yes. Let's catch up. That'll be nice.
Thank you.
Thank you. Bye.
I hope you enjoyed this episode, and if you did, please share and rate this episode. I'd love that.